Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. I'm Joe Coe, Director of Education and Digital Strategy at the Global Healthy Living Foundation, and a migraine patient myself for over 20 years. On today's episode, I'm joined by Dr. Sara Crystal, who is also a migraine patient, a headache specialist, and Medical Director at Cove, a telemedicine service providing care to patients with migraine. Dr. Crystal, thank you for joining us on Talking Head Pain today.
Thank you so much for having me today. I'm so excited to speak with you.
My pleasure. So can you give us a little bit of information about your background, what brought you to headache and migraine medicine?
I started out my career as a physical therapist, and that's how I became interested in neurology, really working with patients with stroke and brain injury. But I became interested in migraine specifically as a resident, seeing how much patients could improve in just a short while. Just watching patients walk out, better than they walked in. And really my own experience with migraine too is what drew me to it. I've experienced migraine since I was 12 or 13. And interestingly, although I had a bunch of diagnostic tests as a child, I don't remember getting any specific treatment to help me. So it was really probably 15 years later as a medical student actually doing a rotation with a family doc. And I mentioned my migraines and he said, why don't you try a triptan? And he gave me a sample of something. And that was actually, pretty life-changing to know that there was a migraine specific treatment, but I had to wait that long for relief.
And have you found that being a physician has helped you better advocate for yourself?
Yeah, I think so. I mean, in some ways, doctors are the worst patients because sometimes symptoms that we take seriously in patients, we try to, tend to minimize in ourselves. Also, I mean, I know, when I experience something, I know, okay, this is within the range of normal, not too worrisome, but it does help. So, and obviously not everybody has that advantage. So it's really important for people to be armed with knowledge, however they can get it, so they can get appropriate treatment for their migraine condition.
Something I like to ask all of my guests that live with migraine, what was your worst migraine attack like? What did it feel like? What was the experience?
I experienced my worst migraine attacks during pregnancy. And to this day, I'm not sure if these attacks were what every migraine would end up without medication, because I was really trying to avoid medication, or they were just something extra. And I remember calling my doctor. I was just flat out in bed and just vomiting like crazy. And then the advice that I got was go drive yourself to Dunkin' Donuts and get a coffee. And I didn't even know what to do with that. I was it was almost laughable. The idea that I could even get out of bed and get in a car and get myself a coffee, and that was all I needed to help me. It was just unreal.
Really insane. Reminds me of an experience I had last month in an urgent care setting. I was having an attack, but also thought I might have had COVID. And I went in and I said, here's the medications I'm on. I have migraine. I'm having a really bad attack, but I think something else is happening. And they were like, well, your medications aren't working if you're having a migraine. And I was like, it doesn't really work that way, but give me my COVID test and let me go home. I ended up having COVID.
Oh.
I was tested positive the next day, not in the clinic, at home. So that was an interesting experience. People that don't really get it, I think is the common theme, that like this isn't really happening, or it's not that bad, or your treatment's not working. This person knew nothing about migraine treatment or how it worked and was quite dismissive.
That's
So
awful.
I understand that feeling, and I hope they at least recommended an iced coffee and not a hot coffee, because I couldn't imagine
Right.
having a hot coffee. So I think it's super interesting, Dr. Crystal, that you have this physical therapy background and you're also a neurologist. Do you have any practical tips for migraine patients that you think folks should know?
Yeah, so I think that background does help me think a lot about ergonomics and, the role they may be playing in, it potentially triggering attacks. I remember doing, telemedicine at the beginning of COVID, and obviously there were many reasons, for people to report worsening headaches, but that was, abrupt change to work from home, and people didn't have the right setup. And so, I think addressing at least that piece of it, what was helpful, thinking about your setup, your computer, how is your neck position when you're working. So I bring in that background, and then just in general, because the cervical spine is so important. There's so much crosstalk between the trigeminal nucleus, where migraine comes from, and the cervical spine, that migraine can manifest itself as neck pain, and conversely neck pathology can trigger migraine. So having that background, being able to address that with patients, I think helps.
I think that's so important, particularly as you said, as we have adapted and our spaces have changed and we think about how we engage in the world. That ties into my next question. Last year, you co-authored a paper on telehealth and telemedicine platforms like Cove, how they can increase access to specialist care. Are you still seeing that same access issue as the pandemic might be ending or becoming more of the norm as opposed to this one-time incident? And can you talk a little bit more about telehealth and its role in migraine?
I think really there, even prior to COVID, there were and there still are, large areas of the country where people don't have access to specialty level care for headaches. So, we know that, here on the East Coast, on the West Coast, there's, a number of specialists, but, there's large parts of the country where patients just don't have access to specialty level care. So, that's where Cove and telemedicine can really help bridge that gap to access. During COVID, patients that normally had access, couldn't get in to see their doctors. But I think there was a role before, and will continue to be a role for patients really everywhere.
So we have both providers and patients listen to talking head pain. What's some advice you would give a patient and a provider to make the most of telehealth appointments? So first, what you would tell patients how to prep for them, and then to your fellow providers, what you would share with them to get the most out of a visit via telehealth.
So, from the patient perspective, really just having as much data when you come into the appointment. So, a migraine diary, not everybody loves to keep them, but they really, I think, are very helpful to look at triggers, look at, medications taken, acute medications taken, whether or not they helped, to look at, if you started a preventive medication, comparing before and after to see if we're, going the right direction in terms of reduction in frequency, look at timing with menstrual periods for women, bringing in that data when you come into the appointment. From the provider standpoint, really having that information is key. If possible, reviewing that information even before the appointment if it's available, so that you can target your visit, your questions appropriately.
Definitely. And have you found, either through your own experience or hearing from colleagues, how to create that trust and bond via this digital mechanism of telehealth? Because it's such an intimate experience going to a provider, especially when you're in pain.
Yeah, it's so interesting. First of all, I think that actually people in some ways are more comfortable via telemedicine, because they're in their own space, so they have that comfort level. And Cove is actually an asynchronous telemedicine practice. In other words, patients, it's sort of text-based. Patients fill out a very complete questionnaire about their headache and general medical history, and then there's messaging back and forth between the provider and the patient to follow up on on information, and to talk about the treatment plan, and the patient has the opportunity to ask any questions. And it's so fascinating to me, and it's so rewarding when I see comment after comment that patients say this is the first time they feel heard. And it's so interesting because this is there's no face-to-face encounter even, but to have that knowledge that that this doctor is focused on your headaches specifically, and they're here to help you with that condition, it really is so reassuring to patients.
What does it feel like when you see a patient or hear that a patient has gotten relief because of how you've helped them?
That is just the best feeling. It really it just makes any difficulties, it makes those go away. Whether I hear it in clinic, where I practice, or from our telemedicine patients, it just makes everything so worthwhile. You just feel so great. A couple of people I saw yesterday, one person said, you got me through such a difficult year. It just makes you feel so good. I mean, knowing that you're helping them function, that you turn things around for them, it's the best.
Really good reminder for me to share those experiences with my provider. I'm thinking I was at the hospital, my grandmother was passing, and I brought my migraine medication with me. And after she passed, I remember taking it and looking at in the garbage, and the wrapper was in the garbage. And without that medication, I think I would have been sidelined for a couple of days because it was, a big trigger. And I wasn't, which really surprised me and my family. It's important. I haven't always been in that place where I've, been on the right treatments. And it's so hard, as you know, as a provider, for patients to advocate, and providers with, prior authorization and step therapy and all those fun things, to get on these right treatments that make it so you can function during these like really difficult and or positive life experiences like weddings and big events. So I have that visual image of that hospital moment and taking migraine medication and thinking back, looking at it like, oh, now I should tell my neurologist that his proactiveness, and we've had to fight with our insurance company with prior authorization to get on that treatment. Thank you for that reminder. That's a good one.
Yeah, that is so frustrating, but and I'm sorry for your loss, and I'm glad that you were able at least to get through, like you said, get through it. What could have potentially been, a really bad trigger when you had to be, you absolutely had to be present.
And I'm happy that I remembered to run back to my house to grab it as I ran out to my car. I'm like, let me get my migraine medication. So a reminder, not only to take your medication, but to remember to bring it with you when you might need it, which is a big problem with me since I don't carry a bag and it's just not there. So that's a tip.
Yeah,
Take and
that's
bring your
great.
medication with you. For those of us that haven't found the right treatment like I have, how do you advise folks to manage their triggers?
That is a great question. So some triggers are avoidable, and some are not, right? So we can't change the weather, so and the stressful situation like you described with your family, that nothing to do about it. But I think, realizing that triggers are additive, so trying to address the ones that you can help. So if you know that you're going to be traveling, maybe minimize alcohol if that's a trigger for you, that maybe normally you can cheat a little bit with that. That's when you have to be careful. Try to get as much sleep as you can. Try to stay well hydrated. You may not be able to change the stress part of it, but those triggers that you can manage, do try to avoid.
Definitely. I have a follow-up to that around travel. Staying hydrated is so important for me and many people, but it makes me have to use the bathroom so much. So I was talking to my doctor and he said, just make sure you get an aisle seat. Stay hydrated, but get the aisle seat. So now I really just really push for the aisle seat, even though I'm a short guy and normally taller people want that. For the leg room, I'm all about the aisle seat so I can get up and stretch and use the bathroom because I am maintaining that level of hydration while flying, particularly. I've noticed that has helped. Is there anything that you wished society as a whole knew about migraine that, we know because we live it and we work in this field, but what would an average person need to know about migraine?
To realize that it's not just a headache, it's not just the pain, it's everything else that goes with it. There's there's the prodrome, the postdrome, that migraine hangover, that your friends or family with migraine, even though you can't see it, they really are suffering, and to be understanding. Employers too, right? Understanding that just because you can't see it doesn't mean it's not there, and to be accommodating and understanding.
Dr. Crystal, how has platforms like Cove helped folks get access to care?
We have demonstrated through a couple posters that we presented in the past, and recently the American Headache Society and with the American Academy of Neurology conferences, that we are improving access to patients, for patients that lack access, whether due to geographic location and also due to other barriers. Recently at the American Headache Society, we presented a poster that showed that we are providing equitable care to patients that are part of underrepresented populations.
Thank you for joining me on Talking Head Pain, Dr. Crystal, and for the valuable advice you've shared with our listeners.
Thank you so much for having me.
And thank you, our listeners, for listening to Talking Head Pain, the podcast that always confronts head pain head on. If you like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.